Hello and welcome to another episode of Inspired Men Talk. And I'm going to pass over to Gary to talk about our sponsor for this episode. So, Gary, if you'd like to tell us about our sponsor for this episode.
Absolutely. So our sponsor for this episode is Mental Health in the Workplace, work in partnership with organisations who recognise that success of their organisation is reliant on the success of their people, and that people's success ultimately comes down to their level of mental well-being. So if you're an organisation who want to improve the well-being of your teams, your individuals, and anybody who works within the organisation, mental health in the workplace may well be the people who can offer the best change in training and the culture of the business.
Thank you very much, Gary. And so, yes, my name is Peter Ely, and as you know, I am a solution-focused hypnotherapist. I work with people who are struggling with their self-care. So if you work through your lunch hour, if you work the weekends, if you have to hand back annual leave, perhaps it's worth having a chat with me before you get to the burnout stages. And with me, as always, is Chris Johannes. Chris, hello.
Yeah, my name's Chris, as Peter said. I'm also a solution-focused hypnotherapist. I also am a landscape gardener. I also run a scout group local to where I live, so I like to keep nice and busy.
Excellent. And with us is Ben. Hello, Ben. How are you? And could you give us a little bit of an introduction to yourself?
Hello. So yeah, Ben Baker Pollard. I'm a solution-focused hypnotherapist, but also my prior experience, I was a police inspector in the police. I've been in policing for 18 years. So different perspectives, but happy to be here tonight with Fiona.
Excellent. Thank you very much, Ben. And last but by no means least, Gary. Hello. Would you like to introduce yourself? Oh, he's on mute again. You're on mute, mate.
Only everybody else.
It's your mute button.
So my name's Gary and I'm from Inspired to Change, and over the last 13 years everything I do is around improving people's mental health, whether that's one-to-one where I see clients or one-to-many where I do training and support people and organisations to get the very best out of themselves and their teams.
Thank you very much, Gary. And as always, now we've started to have some guests with us who are coming to talk to us about various different topics. And this week is no different. And today we have a very lovely guest, a very wonderful and engaging guest, Fiona Flaherty from Medicate. So good evening, Fiona. How are you?
Thank you, Peter, and a lovely welcome.
Thank you. And Fiona, if you'd like to tell our listeners a little bit about you, who you are and where you are and why you are at where you are. Let me start again. So Fiona, thank you. If you'd like to tell us a little bit about yourself, tell us what it is that you do and what's your journey been to get you to where you are today.
Lovely. Yes, of course. Well, I've lived a long time, Peter, but I've still kept my hair, so that's a plus for a female. And I wandered accidentally into men's health. My background is I've been in health for over 45 years. I came up through a traditional nursing and midwifery route, which predominantly was females. It's female workforce, female managers, and the wards were then divided into men and women. I had to do the female wards, as you do as part of your training, but I did find, having done that and done midwifery, I'd really got quite tired of women. Because they think emotionally, they buy emotionally, they make decisions or they don't, they change their minds, and it was tough. So what I liked was all the male stuff. I liked male orthopedics, I love male pelvic health, I like male mental health, and I love cardiac. And the reason I stuck with all of those was because the care was exactly the same, the delivery was the same, but they received it much more positively. And they didn't question what was being done so long as it made sense. So the nice thing was that men just got better that much faster. Now, the reason that men get better that much faster is men tend to be much more analytical. Us females would like to tell you that you don't know what you're doing. You're a grown man, you come down the stairs completely fully dressed, and for some strange reason we ask you, does that tie match that shirt? Are you going to wear those shoes with those socks? So we start straight away. If we ask you to compliment what we cooked, we say you didn't like it enough because you didn't like it as much as the last time. If we ask for your opinion, we disrespect it because we tell you that actually we don't believe what you've said. But I found when I was dealing with men with something which was tangible, which was give them the stats, give them the information, give them the facts, and tell them there are two options, this or nothing, they went with it. So I've been playing for a very long time as a non-sports person with men, football, because they will talk about a missed goal for as long as the goal. But one of the best ways for me to actually get to men was to work predominantly with men, work in men's health, get out of illness and go into wellness. So in 1997, I set up my first company in Harley Street. I had a lamp, I had a leather chair, and I thought I'd made it. But the men weren't coming in, the women were. So then I refocused and I changed a few times. And then I went out to work in the Middle East. And I found I was dealing with men there who were very easy to work with because, again, it's all about they'll do what you say because their goal was whatever they'd come in for. They didn't have too many hidden agendas. But they didn't want to talk. There wasn't a lot of adjectives, but by and large, they just wanted results. So when I came back then, I decided I would focus purely on men's health. And so thank you for that introduction. I actually did a master's in public health, and I looked at all the things that men would worry about. I went into the pelvis first, and I looked at chlamydia.
Oh, let me just hold up for 1 second because I want to ask you, why did you choose that whole men's mental health masters thing? Because that seems like I don't know if it was were you like one of the only females in that course?
So I went to an international public health college to do it, university to do it. What I found was the men's perception was totally different to the women. I was one of two women who were interested in men's health, but it was about our perspective. The men were into making it not a problem anymore. And myself and another colleague were finding the problem, taking it out, laying it open and giving it back to them to do something about it for themselves. So I looked at chlamydia, I looked at triggers like smoking, I looked at men's general diet and nutrition, and so I actually did my dissertation on male suicide. And what got me thinking was, it isn't a very different model to how we deliver health in this country, but the NHS was set up in 1948 for women and children, not for men. So probably an answer to your question, if women have a problem with breast tissue, then go to a breast clinic. If a man has a problem, he goes to thoracic. If a woman has a gynae problem, she goes to gynae, and a man has to go then to general surgery, general medicine. So I realized that there was a huge, big gap. And the only way for me to address that gap was to make men matter.
Fantastic. Thank you. You've said a couple of things there that I'd completely forgotten. I remember when I was younger, I was in and out of hospital and wards were male and female, and I'd forgotten that. So, gents, let's bring Gary in. Gary, you've done a master's. Tell us a little bit about, well, I want to start with that. Why did you choose, you didn't do your master's in men's health, though. Can you tell us what did you do your master's in and why you chose that topic?
I did mine on the neuroscience and psychology of mental health at King's College, but I did it just quite recently. I only graduated last year.
Congratulations.
And the reason I did that was because I do a lot of training for other people, whether that's within our team, whether that's training other people who want to be therapists or generally. And it's, for me, it's always about what's the latest evidence, what's the newest stuff out there. And more importantly, Fiona's talking beautifully about the gap in men's mental health, which I think is really important. Unfortunately, there's still a bit of a gap in my opinion, but the neuroscience is teaching us so many new things, and it's keeping abreast of that. And I think that's really important, that we're continually updating on the latest evidence, the latest knowledge, rather than going on, oh, we did this 20 years ago and it worked then. Well, we've got to go, well, what are you going to do tomorrow, not yesterday? And I think that's really important, to go where the science has taken us rather than just guessing. So that's why I did it, so I can be able to support people more, whether that's trainees or people who I meet.
Amazing. Thank you very much. So I'll ask one more question, and then after that, I'll kind of open it up to the rest of the team. Fiona, can you shed a little bit of like, we had an episode a few episodes back with a company called the Ollie Foundation, and they're a suicide prevention charity, and they talk very passionately about suicide in general, not just male suicide. But can you maybe shed some light on what you found out on why suicide rates are higher amongst men, and maybe what are some of the factors that might contribute to this?
Yeah, of course. If I tell you what I do now, so I can backtrack and you can see. So I work predominantly in men's health screening and nutritional and lifestyle planning. My reason for doing that was there was a big gap. So it's about very much perception of male role, and we still haven't lost that. We haven't lost the fact that men provide, even though women might work, and perhaps it's a salary issue, that men share childcare. Now they're having to share care with the COVID dogs. They're actually getting more involved in family life. They spent a long time in COVID living at home with the entire family that they've been paying for, but they probably didn't know. And society's changed. We've got blended families, we've got people living apart. So traditional male roles have disappeared. So from my research that I did, I was looking very much statistically with coroners in Norfolk, Suffolk and Essex. And I was looking at what's written on death certificates. And what was really scary was often suicide and suicide ideation gets missed. It gets missed in casualty because the priority is to look after somebody who's come in with a heart attack first, because you've come in with an attempted suicide, so you get missed. The gaps between the community health services and the health service and hospitals is still wide and widening, because without a diagnosis, they don't know where to put you. And sadly, when you get a diagnosis, it's very hard to unravel that diagnosis. So people sit with diagnoses like depression and anxiety for a long time without anybody actually taking anything that works. So I worked for a long time so I went into companies, but my most interesting remit was when I went to work on construction sites, where you get men to talk to men, and their conversations were usually very short, not many descriptors, answering the question without having to endorse it or qualify it or make an excuse or explain why they'd come to that decision. So when they have things that are troubling them, they're solution focused and they can't find solution, they carefully take that out and put in another F word called failure. And that's really where I rest a lot of how I run my business now, which is I talk about failure first. Mm-hmm. And it's not always about finding a solution. It's allowing them to articulate that they've got some failure going on, rather than brush it under the carpet and pretend it doesn't matter. If you look at any kind of treatment model in the health service, which is allopathic, men may go to a GP later, but they tend to stay on their medicines without questioning them. They take it because that's obviously what was suggested to them. And I think there's more in life that men could access. They just need give themselves the permission to do it.
Yeah, that actually resonates very much with me and was very much a part of my medical kind of model. And we talked about this, I think, on a previous podcast. But you've obviously worked in the police industry for a long time and the police force for a long time. And has your experience of men when they've been in the emergency, like in the hospitals, in the emergency wards, in the A&Es, has it been that kind of thing that Fiona was describing there, where kind of men, where the hospitals will deal with the put suicides to one side and deal with other stuff first? Has that been your kind of experience of things that you've seen?
I think you've got to remember that when I've been seeing them in the policing, crisis point has hit. It's either because they're at the point of suicide or attempting to do it, or they're going into hospital because they've suffered injuries from violence or something that's happened. So it's a slightly different way of introducing them into the system, and whether they fully talk or expand on what's going on for them is always that challenge for maybe the mental health team or the doctors that are treating them. But what I find interesting is the way you talk about it, Fiona, and it's brilliant to hear that you keep it that simple, because I think that to me is almost like a moment of clarity, that if we actually speak to guys in that simplest format, they'll follow the instructions and get the outcomes that they need to achieve. And you mentioned that you started with chlamydia. So one of the questions that we never actually got anyone on the program, you might be able to answer it or not, but was how do men with like the sexual health problems generally come to light, and what's the stigma surrounding that and getting them in? And is that when perhaps you get the offload because there's some sort of problem that they've got that they can't avoid anymore?
Yeah, I could spend all night here talking about the pelvis. Probably an answer to your question. So let's just take something like chlamydia. And it used to be the stigma, wasn't it? Because we've had everything from black clinics to gum clinics to sexual health clinics. And I do run a sexual health clinic once or twice a month. How do you get them to talk about it? It's dead easy. You start the conversation with the most difficult thing, which is if you can't see it, smell it, and you don't know it's there, how do you know you've got a problem? So sometimes talking about something as simple as chlamydia, you can actually talk to them about their mental health, which is an easy fix. So chlamydia still remains highest in the over 50s, whereas we'd assume it's the young people having a great time. So therefore you've got this, so there's hope for some of you yet. And that's because, again, if you look at sexual health, which has been divvied up in the health service, even with the private sector, it's that will you go in because you're too old to go in, so I'm not going to action it? Or actually, who am I going to tell that I think I've got an issue? Because women have toilets, and I can tell you we have doors, but we have conversations in our individual cubicles at the same time under the doors while washing our hands. Men go into urinals, and having worked in construction, they don't even have a conversation. They're there to do one thing and one thing only. And so, in answer to your question, chlamydia to me is the same as mental health. You've got to talk about it and just sort of, say to them why it's an issue, which is why in my clinics, I offer every single man that walks through the door a PSA and a chlamydia. Because if they don't want to talk about it, I already have. Saying no to me is quite a tough thing because I just have to understand if you know why you said no, because you always have the option to come back to me or to someone else. It gives you permission to start a conversation. Just start the conversation.
I think that's a really powerful thing you've said. I mean, we talk a lot about this stigma that men don't talk, and the fact that actually we're big advocates that men do talk, given the right environment. And I think that's just, you've nailed your way of doing that, your way of breaking down those barriers and just opening that conversation. It speaks volumes for what we are all advocates for, that men do talk given the right circumstances. A lot of the things you mentioned quite early on actually surprised me, even though they're so obvious. Like you talked about the fact that there's lots of the NHS was set up for women and children, and that's evident by the different clinics and different things that are available. And it's something I never realized. I'm a man in my 30s, and I never really registered that women do have lots of specific areas where they can go for different areas of their health, but men don't. We get lumped into the general surgery as it is, and that's actually surprised me, even though it's so obvious.
Yeah, it resonated with me, Chris, and I work in the NHS on the ambulance. And like the minute you were saying it, Fiona, I was like, oh yeah. That's like a smack in the face of reality, that how blatantly obvious it is.
You've only got to read the signage. Yeah, that's exactly what you look at the signage. I mean, perfect example. It will say come into outpatients, it's on the left, it will say female, children, maternity, etc. And I think, God, men are missing.
I was at the doctor's hospital today with my son, and he was at the Children and Young People Services department.
Can I ask a question of that then? Because, there's loads as always buzzing around my head, but that's taken that little bit what the NHS was set up for. I get the opinion that women demand more. So if they haven't got the service they deserve, they'll make sure people know about it. They'll stand up for themselves, or men will just go, and then go back to doing whatever they're doing. So we don't make enough fuss as men. Certainly my age group, I think. We will moan if there's no pies at the football, but not if there's no signage or services for us, where women will demand it. Am I right in that?
I would actually say that it's because we just need to keep it simple for men, which means that you do have a choice. You know what you like, you know what works best. You don't do failure. So, if you're asked to do something, you might sit and read the instructions and then do whatever you're meant to do. With a female, and I use myself as an example, we have a go, and when it doesn't work, we tell you it doesn't work. And the first thing you're asked for is, have you got the instructions? So The
Men
gap
don't
is-
read instructions, sorry. I haven't looked at the I mean, I've got lots of things, but
But
they're all
it's
taking the mick out of me
to be
that my
written. It
headphones
has
don't work because I haven't looked at the
exactly.
instruction book.
Exactly. But I think if we look at sort of the male model, which is the allopathic model, the way the NHS runs, that we are assuming all the time that men's health is always going to be around heart disease and bowel problems and whatever. Well, actually, if 1 in 4 men's not going to make retirement age because of suicide, that's a big scary stat.
Do you know what?
We just don't acknowledge it as it's the biggest social issue that's not addressed.
So, Fiona, you've just hit such a fundamental. I do a lot of work around suicide as well, as the guys know. No one's ever said that. I've worked with lots of charities, lots of funds. I've done fundraising myself. No one's ever said it like that. And that's just struck me between the eyes. 1 in 4 men don't make it to retirement age.
Which is now 67.
That's just hit me between the eyes. And I talk about these stats all the time. I've never heard it like that. So I don't know if that's a gift or terrifying, but wow.
Maybe it's because you're that age.
Shut
I
up.
mean, maybe that's why it hit you so hard. But it is a good point. It's just another perspective. And that's why it's great having people like you on, Fiona, because we all have our own perspectives of these things. But just somebody saying something like that can change the way we all view this, you know. And I feel like I'm going on the same point again. But do you think if the NHS did have more male specific clinics, so if there was a big sign saying men's mental health clinic on the door, do you think that would help men go there? Or men's testicular clinic? Do you think that would make more men go, oh, well, there's a place for me to go then? Or do you think it would be, don't want to be seen walking past that sign. I want to make sure I don't go past that. I'd rather walk past a sign that says general surgery than nobody knows why I'm here. Does that make sense?
It does. So let me ask you a question. If you follow a particular sport or you go to football, or obviously no Gary goes because if there's no pies, he's not happy. Did you have to have permission to go? Or is it assumed that because it's now a habit for you, you always go?
I mean, I'm not particularly a sports fan, but I can relate that to a lot of other things in my life. And I think, yeah, it does become an habitual thing for me. It does definitely become, like I mentioned earlier, I'm a scout leader. I run a scout group. That is, if it's a Wednesday, I'm doing that. You know, it's not an option. It's what I do.
So one of the ways to create a safe environment, I'm not even talking about the health service, but one of the ways to create a safe environment is have no-go areas for women. It's quite simple. You know, we do it with breast clinics where they try to put female staff, female radiographers, because that way, if you've got people from cultures where they don't want to be seen by a man, we do it, but we don't do it for men. We just don't do it for men. We just
Do you think that would be accepted?
Do I think that it's about making a demand?
Yeah, I don't want to pull a thread here, but do you think if you did that, there would be people that would go, well, that's not fair. That's not right.
Do I think, of course, there'd be objectors, but you represent 49% of the population. So you've got a big voice. That's quite a big vote. Yeah. And you just have to make the demand and say, yeah, what it is you need. And I think as well, if you go into the workplace, we do the 2 M's. We do mental health and we do the menopause. Well, hang on. The men have got andropause. That's 51% of the population is a beneficiary. What about the 49%?
Could you tell me what that is, please? Because I've never heard that term.
Right. So with changes in HR and legislation, companies now have to create wellness in the workplace, and it's about time. And the areas they focus on is great mental health and well-being. And the other area is menopause. So it's the females when she's going through a transition with her hormones so that she's no longer fertile and she's either pre-menopausal or menopausal or postmenopausal. Because of changes in your hormones, you're going to have perhaps some flushing or some sweating or some brain fog or all of this because your hormones are actually changing, you know, the biochemistry in your body. So organizations have to make sure that they have encompassed that in their policies so it's fair.
I'm sorry, the men's version of it.
I like to call it the menopause.
Yes.
Term, which I love, which is my favorite talk to give, but it's called the andropause. It's the absence and it's a pause. So the menopause is actually a Greek word and it means absence from the lunar month. And that's why years ago, they used to say women were howling at the moon once a month.
Okay.
It's interesting what you're describing, because when you're describing this segregation in the NHS, or this option of having somewhere for men to go, do you know what it reminds me of? It reminds me of pubs many years ago where they used to have a tap room and a restaurant. And
Yes.
men went in the tap room and they swore and shouted and carried on with life and were able to vent, while the family or the wife and the children went into the restaurant part, and that's where they sat separately. And it did create that space for guys to go and talk. So I think definitely there would be a huge uptake on that if they knew they could go to places that were male orientated and focused around us. I think that's great. And also the stats that you were talking about, I think is, like Gary said, is quite profound. And actually, I've just had a quick check on the national segmentation from the leading the NHS and the future of the NHS. We went to the Royal Society of Medicine, and looking at the anxiety stats and all the stats they presented them as a whole without the gender being a factor. So I think it would be incredibly interesting to see the actual breakdown of who comes out top with the anxiety, as that's mental health, and whether men are higher than female.
So in mental health first aid, they do show that a little bit. And they generally say women are 2 times or 3 times more likely to have anxiety than men. However, more men self-medicate. So it swips back to front, where men will have medication issues, whether that's alcohol or gambling or whatever coping mechanism they need. So they have a different scaling. So they don't have the anxiety because they're medicated with alcohol generally, but sometimes drugs, sometimes all the other things what they might use for coping. So it doesn't show up as anxiety, it shows up as other conditions.
Can I ask you a question, Fiona?
Please do.
So you mentioned what you do now and that you open these conversations quite well, as far as I'm concerned. You drop those conversations so they've got nowhere else to go but to talk. What do you do with that information if you do find somebody who's struggling with their mental health?
I find it very easy because I come from a health background. I have the advantage, and I've worked for pharmaceutical, I've worked in clinical trials. So I know what the course of action will be if you're going to fall into the NHS. I know from getting you in to see a GP, if I write a GP a letter, no GP will ignore me. I will be on the phone. I will get you into where you need to be. I will get you access to services where you need to be. So whether it's somebody who's got some anxieties going on, because I don't like labeling, I don't like words like depression because that's a medical term. I like low mood, anxiety. I like to use all the descriptors you've used, because if you're comfortable and stopped at, I'm not sleeping and I just can't concentrate, that's what I want to work with, because I think that's really important. So I think it is easy to get in. We've got to make the job easy for the health service because it is low in numbers and it's overwhelmed. So if you have an issue around your mental health, and we all have mental health, if we didn't, we wouldn't be humans. But if you have an issue, men tend to sort of pass it off as not important enough to tell anybody. Whereas if a female has a headache, yeah, you'll know about it. If a female has an issue going on about it, you'll know about it, because we're going to cry in public. We're going to cry. With the men, it's this stoicism, and you've got to be brave and you mustn't do that. And sadly, it happens in school. We rub their knees, little children, and say, don't cry, you're a big boy. We've still got an awful lot of division of gender that society is still perpetrating as that's the way you need to be. But getting access is not difficult. It's actually not difficult for any of us clients to get access to GP. You've got to write the letter so you've made it easy for them to action the points and they feel that they can do it. And you start with the NHS guidelines, which you've been referred to, earlier on. Look at what the guidelines say. What are the access points? I think the gap with the health service is the wait. If you've got something going on, waiting is not an option. Nobody's promised tomorrow. It's today you need to get some.
So, Fiona, that flies in the face of so many stats around there's no doctors because they're low in number, there's no appointments. I think I heard today they're thinking about cutting tens of thousands of appointments to go fit in with the budgets and everything. And you're saying you can easily get an appointment if you do it right, where the average person in the street doesn't know how to create that link, write those letters. As a specialist, as somebody who works with people, if I write to the GP, I never ever had a response. I write, the practice manager will get there and they'll go, oh, it's just a therapist, and they won't respond. And that's happened many times. So I agree with you, but not many people have got a Fiona on their team. What does the average person who's struggling try to get into the doctor, has been palmed off? And I see this client after client after client where they've been through to the doctors, they've been through with the whole weight, and they've ended up at my door because nobody's on their team writing the right letter to the right people with the right guidelines, and they wouldn't know where to find them because we don't educate our public on public health, and maybe not many people are interested. So how do we help those people?
I think it's about, you pointed something out that quite importantly, which is they shouldn't be coming to you last. You should be at a point somewhere in their timeline.
I agree with that.
It may not be at the beginning, but it's telling people that there's options. This free NHS model is misguided. So people assume because it's free, that's the only access point. I'm always interested in what have you tried already that hasn't worked? So, yeah, what did you try to help you sleep? Did it work? Yes. For how long? Great. Why aren't you taking it now? So when you actually point out to them that they've actually made a huge amount of inference in terms of trying to adopt changes, maybe reduce some of the triggers, maybe change work, change some things in work. It's about permission. And so the letter you want to write to the GP is the letter that you would like to read, which is, having tried all of these and they've worked to a degree of something, a lot or nothing, this is what you want. So my letter to a GP will outline why they came to me, all of the things that have been successful, where the gaps are, and what the GP needs to do about it to address those gaps.
Real sense.
So, and most of us can do it. We've moved on from medicine. The NHS is set up in 48. We've moved on. The doctor is not at the top of the tree. You and I sit in the middle of this tree. And as far as we're concerned, all of our needs are on the branches, they're on the twigs, they're on the leaves, they might be in the roots, they're somewhere. And the patient, has the opportunity to make decisions. And I'll qualify that by saying something, and you've said it, and I think somebody else said it earlier, is we have clients because we're all in independent practice. When you have a patient, they are now handcuffed because they have surrendered. And therefore they are getting, and we've all been patients of the health service, and I applaud it because I'd worked in it, but you are a patient. You don't have to surrender all of your needs to them, just the ones that you think that they can adopt.
I think that's an important statement. I wouldn't be here right now. I'd be dead and buried many years ago if it wasn't for that NHS. And I don't know what other people have got to say. So for the NHS, for me and my family, they are superheroes. Yeah. But there's sometimes they forget their cape. They really do, because there's other things in my life which are so frustrating that it's just like, wow, when I needed you, really needed you, you was amazing. Now I need you so I don't go back there. I had an appointment last week and my daughter laughed at me because it was my follow-up appointment when I was in hospital 2 years ago. It was my follow-up to see it. And it's just like, what? And the doctor said, oh, you've not been here for a while. It's like, no, you keep counselling on me. And there's nothing they can do about that. They're so overwhelmed.
Yeah,
but
I think you're right. It's when it hits crisis point, you can't fault them. They do what they can. And there's success stories and there's not so much success stories, but it is that preventative stuff or that early help where I think they struggle a lot. I mean, I said earlier, I went to an appointment for my son today and we were talking to and he was actually the director of the place where we were. He was the clinical director of that team. He said he started there 20 years ago and they used to see 4 people a week. They now see 40 people a week and they have not increased the staff numbers in 20 years. So I think, and he was a fantastic consultant. He was a really, really brilliant doctor. He's one of the best ones we've seen. Why has it taken so long for us to get in front of you? And that says it all, doesn't it, really? They haven't increased any staffing numbers in 20 years, but the amount of people they're seeing has skyrocketed beyond belief.
Yeah, no, if I'm going to say tree surgeon because I've just delivered some training to a load of tree surgeons the other day. So if I'm a burly, hairy-arsed man tree surgeon who's got stuff going on, but is struggling to make that approach to the GP and is in that scenario where they're kind of writing stuff off, what would be your advice to make sure that they get the appointment that they need and get access to the people that they need?
With all clients, I do a discovery call, which is half an hour on the phone, because I can sometimes I may not be a great fit for you, but I've got to find you someone who is. So that's my first point of call. So I would need to at least have documented something. Secondly, I want to make it simple. We've got 10 body systems. So if you want to see a GP because you just can't sleep or things aren't great at home, I've got to work out, is it a debt agency you need to talk to, or a mortgage advisor, or your bank, or actually, would you be better off going to talk to somebody about how you feel about your position, your family, which might be some sort of therapy, whether it's a talking therapy, and keep the medical model out of it, because you don't want to, we're not dusting over the top just trying to hide the cracks. What we want to do is give you the opportunity to say, I've taken the lid off, now please find something for me. And so even if I feel that one of your big gaps is the fact you don't do any exercise, it will be, here's a gym, this is great. Shall I write to the PT and say, these are your needs, this is what you need to do? Because you're just not sleeping very well at night and you just need some stretching to go on. So I think writing letters, I love writing letters to opticians and dentists and GPs, whatever, because that you are my client, but you're their patient, or you're my client and we're going to share a client. And this is what I'm handing over to you. And I want it looked after. I want it looked after because, health is something so fragile. When it's gone, it's gone. And everybody would like to go back to how great it was. And you go, well, that's not possible. But how about we create something that's even better? And it's possible.
So
It also costs money.
Fiona, question I've got, because this is Inspired Men Talk, and we come up with a name because we believe men talk, and everybody says men don't talk, and we're all men, we all talk, we can't stop us. But why is men's mental health still 75% of men taking their own lives early? Why don't men talk? Why is there still stigma? Why is men's mental health such a big issue? Because you're right, everything you said is bang on, but it's not fixing anything. So what's it is like the $64,000 question. If everything you're saying is right, and it's fairly common sense, and it's fairly simple to ask those questions, why are we still in this, massive crisis with men's mental health?
It's simple. If you do think about the two bodies, both men and women, we're just basically a skeleton, a structure with the skin over the top and organs inside, with hormones and enzymes and things that work together. And the gap very much is that we've got a biochemical imbalance going on in the body. So men tend to take all of their body systems as, I've got one system that doesn't work, pain, back pain, or I don't sleep very well. Whereas with women, we tend to couple lots of our symptoms together. So we're trying to address a few things, our sleep with our digestion. We may be looking at our neck pain with the same time as the fact that we're not going to pass urine as often. So because men tend to look at their health as one system, one problem, one issue at a time, it doesn't get addressed because they don't bring everything to the table. They just bring the one issue. So getting a 7-minute appointment with your GP, they're only going to talk about one thing, which may not be the root cause. And only ever treating one symptom will never get you where you need to be. That's why the gaps are so enormous. It's because men don't look at themselves as a whole. They look at themselves as parts that are not working well.
To be honest, if I went to the GP and listed all the things that I probably should have gone to the GP for over the last 3 or 4 years, it would be a long appointment. They wouldn't see me, and it'd be hard enough to get the 7-minute appointment, but they wouldn't see me for that long. So if I'm in that situation, what do I do?
Right. So one of the things that I'll say, if I've done a discovery call with somebody who says I've got these issues, I'll say you can book 1 or 2 appointments with me, but I will write you a letter to give you a GP, or I'll give you a GP that will be composed by me. You sign it and you say to the GP, yeah, I've come to see you about, and hand them a letter and let them spend the first 2 minutes reading what your issues are. Because the first thing is you slide in the door and they say, hi, how are you? Fine. And you say, fine. You shouldn't have said fine because you've gone there because you're getting a headache or you can't sleep. And then they'll ask you what's wrong. And you're trying to list all of your symptoms as they've happened. Start with how bad it is. My sleep deprivation means that I can't drive and I can't take my son to school. I can't work because I don't want to drive because my sleep's so inadequate. As a result, I'm not working and my employer says I've had too much time off. What can you do for me? And you've now given them enough information, so you need action. What you don't need is a sticky plaster on top. You need action. And decide for yourself what you want. Is it a talking therapy? Do you want something just to put a plaster over the top? Do you want to be referred somewhere else? It's not about demand. It's about what is available, what is there for you.
Yeah.
I think I need a Fiona letter writing course to start writing.
Oh,
Yeah.
well, happily write, and I do it a lot. If I've had a chat to somebody, I won't say, you know what you should do. It will be, you can consider doing this, that, and other, but I don't know how to start. And I said, would you like me to compose something for you to put into your own language? And that's what you give your GP. It's very powerful if you go for an appointment, and Peter knows it's the way I work. If you come to one appointment with me, the first thing I hand you is a notebook and a pen. Like now, I write everything down. And I say, write things down as I'm talking, because you won't remember what I've said. And it's really important when you go to a GP and you've got your piece of paper, take out your notebook, read from it, read what you want to tell them, but start with the end in mind. Start with what, you want to come out of this. What's the one thing you want to achieve? And if it's I want the sleep to improve, yeah, and therefore I want to refer to a sleep clinic because that's what's waking me up at night time because I'm snoring. Start with what you want.
This is what we should be investing in. Somebody like yourself as a port of call as to the people who don't know where to bloody go or don't know how to get to the doctors in the right way. There should be somebody that we can go to like you. Everybody should have access to that. Somebody who can just point you in the right directions and be your advocate.
The challenge is, as all of us are clinical therapists, it goes against our code of conduct to interfere with medical status. So somebody comes in here and sees us, unless they're showing signs of danger, either to themselves or to somebody else, we shouldn't interfere. And that's part of our training and that's part of our code of conducts. So and I have got no medical training, and I'm a really good therapist, I hope, but only as a therapist. I don't have that medical knowledge and medical background. We've got people in our team who do, but that's just a chance. So it will be inappropriate for us to tell people we should write letters. We should tell maybe our clients maybe they should write a letter, but it's like, how do we get this message out to people generally without us having to take that on board? Because this is, again, I can tell my clients if I was skilled enough, but I can only see so many people. Each of us can only see so many people. And this is a general thing, because if every doctor got a list, a worksheet before they had to work, it would save them a fortune of time. So I totally agree with it, but most people don't have the wherewithal or the skills or the understanding of how to do that. So how do we educate people to do that?
I know that now my medical service is an online service, and before I do any appointments, I do have to put in what are my symptoms, what's going on, etc. So I think there is potentially the fact that the medical profession has recognized this and are moving towards it. But I don't fill out that form in the way that you've just described, Fiona. So that's actually been really useful for me. And I think part of that was that I was always brought up to be very respectful of the GP. The GP was someone that, you didn't really answer back to, you didn't challenge. The GP was the person in charge. Now, I don't know if that's kind of changed, and I'm still very respectful of my GPs, and I try to have that kind of positive relationship with them. Have you found that working with men that what that perception is that why men don't do these things?
Well, two things that a GP can do that most of us can't, which is they can certify you dead, but they don't issue the death certificate. Remember that. They can just certify you as dead. And they have a expanded list of prescribing. So if you take those two things away from them, they've actually got the same amount of human knowledge as we have in terms of what would we want done. So how would you get the GP to do what you want to do? sit in the GP's chair, think about how easy would their job be? And it goes back to what Gary said earlier. How easy would it be for a GP just to have clients coming through? Because don't forget, most GPs lose 16 clients a day who don't show up for appointments. Don't show up for appointments because you've done it. You've booked the appointment. By the time it's come, 3 weeks later, Gary's waited 2 years for a follow-up. That's only because of the funding, Gary. That's why they do that, whereas they don't get paid. So if you've waited a long time to actually see somebody, you don't turn up because your symptoms have improved. So you won't bother going. And you won't cancel because you're better. So, you know, think about how could you help your GP do their job better, which is what you've tried hasn't worked today. Just tell them what you need them to do for you that they've got. And it tends to be things around diagnostics and referrals. That's the 2 key areas in which they can measure what's happening because there's a paper trail and it can be funded. That's the gap. So when you're filling in your online e-consult form, rather than you pick a system and then you point out what's wrong, start with, and it says any other notes, anything to upload, start with what you want them to do for you. Not I want an x-ray, I want this, and just say an x-ray would enable you to give me the most appropriate treatment. Give them action points to do. Wouldn't it be great to be a GP? They won't have this great sense of overwhelm. There's a lot of sickness in the GP practices at the moment because they're working crazy hours. And actually they can just you've done the thinking for them.
That makes a lot of sense.
You've done the thinking for them. Tough job. All that is years of training. And then you sit there and everybody walks in, is miserable and ill and in need of care. And it's not because as a public we don't do it, but we're left with a pharmacy which is selling synthetics, prescribed medicines, which is synthetics because I work for the pharmaceutical industry. Yeah, nobody ever talks about food. They demonize it. They tell you what you can't have and you mustn't have and you shouldn't have and you couldn't have. They don't tell you what you can have. Yeah. GPs are not very good at referring people out unless it's back into the system. And then you are then waiting 3 months to see the physiotherapist because of your bad neck. They're not very good at saying you could access, it's a 6-month wait, or you could actually go and see an osteopath or physiotherapy privately to see if that helps you now.
Yeah.
It's not very good at bringing, and I don't like the word complementary alternate. They don't like bringing other therapies in to help the patient's journey speed up.
Yeah.
Nice guidelines, though. You think that's because the clinical guidelines don't really sort of direct them to do that?
No, because it's not measurable. It's because why Gary had got called after 2 years. It's so you can be signed off to show that that's a measurement that's been done. That's what. And it's a pity because the only thing the NHS does around food is registered dietitians, and it's a Greek word for daytime eating. So they spend most of the time telling you what you can't have, not what you can have. And then when you're really unwell, they give you liquid full of sugar protein drinks, and they give you food that's high in carbohydrates.
Yeah.
Which is never going to help.
You said, you know, if somebody came to you, it might just be, well, you need a bit more exercise. But I mean, we've all been told that by the GP, I'm sure, at one point, you know, go and get some more exercise. But you said, this is a gym that's local to you. This is what you need to go and do when you get to the gym. And for me, that was like, yeah, do you know what? I'd be much more likely to go to the gym if I had that sort of instruction. And would it take that much longer to provide that? I don't think so.
Not at all. You know, if you don't want to give your GP letter, I'll take it. I'll write it. I'll follow it up. I don't have a problem because as soon as I can get you into somewhere to help you with your issue, great. I've left a space for another appointment for somebody else who wants help, which is easy. Yeah. It's easy.
Given that little bit more context of this is what you need to do rather than the vague version of this is what you need to do. You know, it's that difference I think is key.
The NHS changed in 2012 when it brought in the nudge approach with the change in health and social care. And it was very much about, we used to have a health service up until 86 where we did prevention and promotion and protection, a public health model. And we don't. It's all about treatment because treatment means that you can put numbers on paper. A lot of people's health issues could be addressed by being given permission and a roadmap. So I do health journeys. You can put whatever you like in your sandwiches. All you need to know is the day, the date, and the time, what time to be there, and what time you'll be finished. And it works. It works. It's about celebrating success. We just need to start celebrating success.
I feel like I need a room with a Fiona in it. At my practice.
Time boys.
Every room.
I think what's really interesting, I work as a naturopathic nutritional therapist as well. I haven't got the answers, but I use my medical knowledge to dig deep. So if you've come in with a headache, I will ask about all of your 10 body systems. So I'll start with your nervous system because you've got a headache. And my second question is always your pelvic health, because I have to address the elephant in the room really quickly. Because if I don't address that, you won't talk about it. If you've come in with a bad back and you think it's just something that you could do, I'll address your skeletal system, but I'm straight away into your digestive system because I want to find out what you're putting in to repair your body. So I will ask those questions. I use functional testing. So I will use hair and blood and stool and feces and genetics, because when you've got somebody's template and it's all laid out and it's a map, your story is different to the next person's story. It's different to your brother, your sister, your dad, your mother, whatever. It's your story. Then you've got a plan. And once you've got the base plan, you just know what to tweak each time you have an issue. But we don't do that. We wait for problems to be solved by somebody else until the next one comes along. Sorry, Gary.
I think I do know, but I'm not sure. But I think we're all very open-minded. So I've had bladder cancer. So I'm very often having people put stuff up pipes which shouldn't be gone backwards. I've got Crohn's disease, so they often call me Sooty as a nickname because everybody puts something in every hole possible on a regular basis for 40 years. So none of that phases me at all. But I was having a conversation last week, and just my wife recently had a mammogram routine, things like that. And it's just like, I'm 60 odd years old, just turned 60, and I can't, they're checking they're checking to see if I've got bladder cancer every 6 months. And on the last time I was there, I said, do you check my prostate every time because you're going through it? And they go, oh no, we won't know about that. It doesn't show up. So even at 61, nobody's checked my prostate. And it's just like, why are they not doing, I don't know how much it costs to test blood, urine, and stools all at once, but how much are you preventing by having that knowledge? So I don't understand why all the people in this room, but maybe not Christopher yet, but certainly by the time you hit 40, and most of them look much older than 40 if you look at them, look.
Speak for yourself, love.
But why are they not just being called in once a year to give a sample of everything, which would be 1 10-minute appointment to do that? You could do it at home, and anybody can take blood. You could train anybody to take those samples. So why, with that, because I don't know why it's not happening. Because I can't see I don't know whether that's a question or not. It's probably a rant. I'm sorry.
Would you like me to answer that, Peter?
Yeah, go ahead.
You're right. So if you look at, again, the NHS model, here I go, up to the age of 13, and we've only just had the HPV virus come in, say, decade. Prior to that, boys and girls got screened until they hit puberty, because you had school vaccines, you might have your appendix out, had your tonsils out. So we'd taken out what we felt was going to help your long-term health. And then with females, we could then go down the route of the pill and contraception and smears and things. But there is no national screening program for men until they get to 60. And the first thing we look at is your bowels.
Yes.
So men have gone now from the age of 13 to 60 with no interventions.
Yeah.
Now, we do smears for females from the age of 25 because the research says that's when you're going to pick up the incidence of cervical cancers, because it's caused by a viral infection. However, if you happen to start sexual relationships much younger, you're missing out from 16 to 25 without being tested.
And I've got 2 or 3 friends in that age group who all had cervical cancer.
Right. So we've got a screening program. We've got a screening program for cervical cancer. We've got a screening program for breast for women for mammograms when they get to age of 50, and we keep going to 69. I don't know what happens when you're 70. I think you take them off and put them somewhere at night time because nobody's interested. Crazy system. Same for smears. Apparently your sex life as a female when you're 69, because you don't have smears anymore unless you request them. You know, you've got to wear a badge that says, I need a smear, I'm 75. You know, it's this crazy system.
Well,
Oh,
actually, a stat you started with that over 50s are more likely to
yeah.
have chlamydia than under 50s.
Men. I only
Yeah,
looked at men.
but they're not all homosexuals.
Not
So
at all.
therefore, having sex with women over 60 or over 50. So it goes hand in hand. It's a simple maths. All this stuff is simple maths in my head, which seems to be over complex.
Mm. So two things. One, I only looked at men. So I looked at chlamydia because I was interested, because I run a clinic, as I said, once a week, once a fortnight. And I was picking up a lot of it. And I thought, well, why is this? And I just thought, it's freedom. You no longer have to be the taxi driver. Your other partner has maybe now gone off to yoga and Pilates at night time or out with their other, other friends. And therefore, you don't know what to do with yourself. So you find yourself something else to do with your free time. So, that's one of the ways to say. And also because we've got more freedom, so we want to do it. But in answer to your question about ministers, we've only had a minister for men's health in the last 18 months. We never had one before. The UK had a minister for women and for children, but we didn't have a minister. So if you follow the Men's Health Forum, there was no minister for men's health. And now she's a female. I mean, rock on, there must be somebody.
So
I'd be all right if you were there, Fiona. I say, well, I would have a good advocate if it was you.
So moving this on slightly, one of the things what Peter said you're really invested in is male suicide awareness.
Mm.
How does this all add up? Everything we've talked about around men's health, how does it all add up to the horrific figures of one person out of 3 won't retire?
Yeah,
One in 4 won't retire.
Yeah.
How does all those medical issues or lack of preventative care in general medicine add up to such a high suicide rate? Is there any correlation?
Quite simply, and it goes back to what we said when we first started talking, was a woman will go in with an issue, but she'll get more than 7 minutes, or she'll speak fast, and so she'll address 2 or 3 issues. Yeah, we've got it down to a fine art. Men will go in with one issue. They're either watching the football or playing golf. But we will cook the dinner, feed the dog, bring the washing in, and boil the kettle. And because we think differently, women make greater demands. Men only make a single demand. And if you think about suicide is the top plate of things underneath that are going wrong. And it's, if you've got 10 body systems, you've got 10 body systems that want looking at. So if your digestive health is poor, if you've got a problem with your insulin and, not saying you've got diabetes, that's an issue. If your digestive system doesn't work very well, so you're not producing happy hormones, all of that has a knock-on effect, so it becomes a domino effect. So we've got to look at health for men as all of the systems important, not just the one. So to come to the top where you actually feel this desperate, putting people on SSRIs or antidepressants is just putting a cork on top of a bottle that's got gas in it. You have to go much deeper. So I'd say men that I meet that say, I'm just not sleeping very well, not this. To me, that's the slow burner. That's the things I need to address. And it could be you're not sleeping well because of your personal circumstances, domestic circumstances, working circumstances, or your digestive system is terrible, and therefore you're not putting in enough great microbes, and therefore your happy hormones never have a chance to surface. Because stress and cortisol is, to me, that is the chimney on the top where the smoke comes out, which tells you there's something underneath that is still an issue, and you keep digging until you get to the bottom of it. We have 10 body systems. So I said, it doesn't matter what you've brought or presented, we have to dig and look everywhere first.
So what I'm hearing, because I deal and we deal with people who are generally in that challenge of they've identified a mental problem, cortisol, stress, all the different things there. But you're saying if they're going through a bad relationship or got a terrible job, they're eating badly because of that stress. And that is already the first sign. When you're not doing this right, you're not doing that right, you're breaking you're getting that domino effect until you reach everything's got a bit pear-shaped and your brain's going, the only way to cope is by not coping.
I see bodies very much like a house. So if I'm talking in clinic, if you're talking to me, I draw a house, I put a roof on it as if it's a child's diagram. I put a chimney on it and I've got some smoke. And as you're talking to me, I'm plotting what you're saying. So if you have a house and structurally it's not good because you've got damp, that's an issue. If you've got an issue where, I don't know, the heating doesn't work, that's going to be another issue. If the wiring doesn't work, that's an issue. So that could be your nervous system, your digestive system, your endocrine system. It could be, and your endocrine is everything from your thyroid. So your generator's not working, your heart's not working, it's not pumping, that's your boiler. Your kidneys aren't working, that controls your blood pressure. That makes you feel grim, you've got no energy. And because of role denomination, and it's not we adopt it, sometimes we're given it, you know, and I can say it as a female, the amount of females, I've said it myself, and I hear women saying, let me do it, you don't know how to do it, I'll do it. And it's engendered. So because of that, it's one thing at a time. So by the time I've drawn your picture of your house for you, I've actually plotted that we've got a lot of problems. So before we actually address the damp that's going on here, yeah, or the fact the wiring needs doing, yeah, before we get to the top, which is the chimney, which is the cortisol and the stress and the anxiety, and you really don't know what to do, and we're going to call the fire brigade to put the fire out.
Because everybody can see it.
Exactly, yeah. Why don't we work with this first? So a classic for me with a guy that comes and said, poor sleep, fatigue, tiredness. And the first thing I say to them is erectile dysfunction a problem for you every night or just some nights? And I'll start the conversation because I'm not going to wait weeks until things have improved and you say to me as you're going out the door, oh, I've got one more thing I want to ask you. Because I've asked it. That then becomes the goal for, let's improve that first. And let's work on everything else at the same time. And it works. And, you know, it could be a combination of, okay, go to bed a bit earlier. You know, leave your, you know, if there's already somebody in the bed with you, why on earth do you need to bring the blue light to bed? I mean, you know where the bed is. So you don't need a mobile phone or an iPad or a telly on the wall. You've got entertainment next to you, you know.
So you're the cause of all this.
I'm just going to go get my other half, Fiona. Just can you repeat all of that?
Your liver is your garbage bin, your waste. It's the stuff that should have been got rid of. You know, so when we take our waste out, our household waste and our recycling, put it in the bin outside, it becomes the bin's problem, it becomes the council's problem, it becomes their problem. If you leave it in the kitchen, you come down next morning, you go, something's smelling in here. So, you know, we need to open our bowels every day to get rid of the waste product. We need to flush all the time to get it out. So sometimes somebody giving you permission to go to bed between 10 and 11 o'clock. And if your liver can't do its job, it saves that waste until tomorrow. And then because you're putting today's waste in, it can't get rid of that much.
Peter's got to be giving us the winding up sign at the moment. But again, it's one of those things we could talk all night on this. But it's like everything you've just said, but again, for me, it just makes common sense. Ben's nodding away, everybody's nodding away. So, but then I've got loads of different ailments. I've got 4 or 5 different autoimmune issues. I've got this, I've got that, and they just give me loads of tablets, all of which have to be processed by my liver.
They're all synthetic.
Yes.
Okay, so you've got what's called a polypharmacy, which is 5. So on top of chlamydia, boys, the other thing you've got to remember is most men and women, but over the age of 50, are on 5 prescribed medicines from the doctor.
I'm only on 4.
1 to go. So on top of that, you know, think about the lives we live, the environmental pollution, really hard to get, drinking out of plastic bottles, heating up in plastic containers, eating food that is probably not as clean as we'd like it to be because you're buying from outside a shop with the diesel fumes and buying your tomatoes from the shops. So if you add all of that toxic load on top, the liver's thinking, oh golly, what shall I do first? And so it has to do the first trigger, which is alcohol, get it out. But some of those synthetics get left behind because the body will say, oh, I'm not too sure how to get rid of these. So you get a cumulative effect. So that sometimes taking our medicines for a reason can make us feel grim. They just can make us feel so grim. So it's about looking at, you've got all of this going on. How long are we going to spend together? Which ones we work on? These are the quick wins. Let's get these ones, get you to bed a bit earlier, give your liver a chance.
So I'm going to ask my last question. I'm going to shut up. But how you're saying to all the men out there who hopefully listen to this podcast, one of the ways you can stop yourself getting into that place where you're thinking about, you're having that thought process of, is it worth it anymore, is to change their health, their physical health.
Mental health is part of physical health.
Yes.
It's not until we hit crisis do we actually identify it, because that's when we have to get other services involved. And your colleague will know, as a former police officer, that's when it then becomes a legal issue as a health issue. So the only way we're ever going to address it is draw yourself a picture of your own house and work out where your biggest issues are, and go where you feel that you're going to get the best support, whether it's a talking therapy or a physical therapy or a screening program, whatever. Start with where you think the gap is, and a good practitioner will say, I'm not the person for you. This is your starting point. I meet a lot of people who say, come to me and I can sort out all of your issues. If you make those promises, it's frightening. And yet people have a relationship with the health service for all of their lives, hoping for it to be sorted out. It can't.
Yeah, I really love the house idea. That's just gone in the chat as well. And I think that's brilliant. Particularly for me, my mind's gone like, if you did that in the IC, when we speak to our clients, if you take that information and plot your house, then as you say, you're laying it out and you're starting to begin to see where things are having problems and where we can go with it.
Yeah, so if I draw something here, and I know it won't be seen, but there's my house, which I'm just showing you here. Yeah, see
You've
it?
got your blurry background. We did catch it a little bit, yeah.
All right, fine, but just draw a simple child's house.
Yeah.
Okay? And if somebody came and they were talking to me and they're talking about everything's going on up here, I write in the chimney. If it's the roof, it can be, I've got tightness in my chest and cardiac. If it's the windows and the doors, I'm looking at digestion. I'm looking at the spleen. I'm looking at the liver. I'm looking at the pancreas working. If it's down here, it's the garden. I'm looking at the waste pipe. So that's passing urine, passing stool. And I actually start plotting where they're going and say, great, is there any point in us addressing the garden first? And unless we actually look at the structure, why don't we look at the door first and agree where we're going to go? And it worked.
Yeah, I like it a lot. Where does your sexual health bit come in? Is that the back door?
Sexual health, that's all the time. Depends, doesn't it? I mean, it can be, don't forget to be top and bottom.
Well, there we go.
Chris, any final thoughts from you?
I think I've covered most of the things that again, it is one of those, Fiona, we could talk to you for a while. Everything you're saying makes so much sense. I just wish that we could all have somebody like you on rooting in our corner when we need just that first place to go, when we don't know where to go. I wish there were more of you accessible to more people. I think it'd be lovely to get you back on at some point, Fiona, because one of the things you mentioned right at the very beginning that we haven't even touched on, and I think it could be a podcast on its own, was the lack of purpose men have now because of I'd say other people, women, taking on some of the roles that were used to be for men, and how that's affected men's mental health. But I think that's a whole new podcast in itself. So, but it has been lovely to meet you, Fiona.
Thank you, and you. Love it. That's why I spend time in company of men, because just keep it simple, stupid. KISS principle. Don't complicate things. Life is too busy to complicate things.
So one of the things that we always ask, before I hand over to you to tell us all about what you medicate and your business and how you support people, one of the questions that we always ask is about solutions. We're solution focused in what we do, and I think you talked a little bit about being solution focused and helping people to be solution focused. If I asked you to boil down advice to maybe one or two sentences, what would you say to all the men listening out there about looking after or how they can look after their mental health and move forward?
Oh, that's easy. Start with the end in mind. You're not going back to who you were, but this new person that you're going to meet, which is your future self, is so much better. It's so much better because you've got a handle on it. You knew what you want to do with it. Anything is possible.
Fantastic. So give us a couple of sentences about Meducate, where people can find you, how they can find you, and how you can support and how you do support your clients.
Oh, it's simple. First of all, you can go and find lovely Peter Ely, because he'll tell you where to find me. But secondly, Meducate Healthcare is my second company. I set up in 2010. It really is about educate me. That's why we chose the name. My husband chose the name for me. And quite simply, we do health screening, nutritional planning, and lifestyle changes, which is easy. we run our clinic in South Woodford in East London, Harley Street clinic down that way, and we've got a small premises in Victoria. But we do pop-ups in the workplace, so we bring our clinic to you. There are 3 of us all together now. And we also go into gyms, opticians and dentists, because you can't just fix somebody's eyes and teeth unless you look after their entire body. We run our clinics by 2 appointments, an initial and a follow-up. And we do functional testing for everybody, which means that if I can find some pathology, I always test, which means I will not guess. So if I feel that your issues are digestive, it's a stool kit. If I feel that your issues are around mood or energy, I'll do blood testing. I have the advantages of 1, I can access testing. 2, I do it in clinic when you're with me. 3, we use private laboratories who are quicker, faster, and easier, which means we can get the results back within 4 hours, 24 hours, but you're never waiting weeks. Because you want results as quickly as we do. And you can't work unless you've got facts and data. It's simple.
Fantastic. Thank you so much, Fiona. That's been a really engaging and wonderful chat, and I really appreciate you spending the time to talk to us. I want to say goodbye and thank you. Chris, from you?
Yeah, again, a big thank you, Fiona, and a goodbye from me.
Lovely.
Fiona, really loved it, and some kind of key moments come out of there for me to take away and reflect. I think about the way we do our practice.
Brilliant.
And you'll help other people so easily.
And finally, Gary.
So it's been amazing and, as always, so enlightening. And I've got to say, I'm going to steal that stat about 1 in 4 men don't make retirement, because it's just mind-blowing.
Well, Peter's met me at meetings, and that's always my standing point. I start with that. I like shock tactics, because the bottom line is it has to change.
But this is someone who knows all the stats. Never heard that one, so I'm stealing it. So thank you so much for that gift. Everybody listening takes on some of the information that you've shared today. So thank you.
You're welcome.
So thank you very much for listening to another episode of Inspired Men Talk. We hope you've enjoyed listening in with us and listening to Fiona. And please feel free to reach out to us on our Facebook page, which is also Inspired Men Talk, and talk to us, tell us what you thought, and reach out. Thank you very much, and goodbye.